Good morning, everyone. And this is the executive member decision session for health and wellbeing and adult social care. I am Councillor Jo Coles. I am the executive member for health, wellbeing and adult social care. I will just start by the declarations of interest, which is item 1. I have no declarations of interest regarding the items that we are discussing this morning. So I'll move to item 2, which is the minutes of the last meeting, which was on the 17th of January. And I will just agree those minutes as a true record of that meeting. And we'll move on to public participation, of which I don't believe there is any. So we can actually move straight on to the main item on the agenda this morning, which is the North Yorkshire and City of York Domestic Abuse Strategy 2024 to 2028, which has already been looked at briefly at a decision session from the annual report of the Public Health Director a few months ago, the outgoing Public Health Director, but we now have our new Public Health Director, Peter Roderick, with the actual strategy, which followed and has developed on from the annual report from the Public Health Director last year. So Peter, if you want to just talk to the report briefly, and then I've got a couple of things I wanted to pick up that I had noticed in the report as well, but the floor is yours.
Thanks very much, Councillor Coles. So the issue of domestic abuse and how we tackle it, how we reduce the numbers of people affected by it, is a key one for the council and for partners. What we're presenting here today is very much a partnership piece of work. Just in terms of the scale, we did some work looking at the levels of need around domestic abuse across North Yorkshire and York as part of writing this strategy. And we estimate probably around 32,000 adults across North Yorkshire and York, which has a population of around about 800,000 people, are affected by domestic abuse. So it's a significant proportion of the population, and we know that the ripples of domestic abuse are felt through families, through family breakdown, through educational disruption for children and young people, in housing, in people's health. It really is a blight on society. But there are things we can do to work together, both to prevent it, and then when domestic abuse is identified, to protect, to safeguard, and to prevent future reoccurrences, which is what this is all about. And there's significant changes nationally over the last few years which impact on this work, not least the Domestic Abuse Act in 2021, which has new requirements on local authorities, particularly around the setting up of local domestic abuse partnerships. And as well as that, plus some duties around safe accommodation, resource that then comes into local authorities, which is a small contribution really to what we need to tackle this issue and to meet those new statutory duties. We have been working as part of that local York Domestic Abuse Partnership Board now for a couple of years, but recognising that this very much needs to be done in partnership across the region, not least because we commission many similar organisations to support people, as North Yorkshire Council do, and we share a police force area and an Office for Police, Fire, Crime and Commissioner with North Yorkshire, and they're very much a huge part of the local partnerships. So we work very closely with them, and even though we have a York domestic abuse partnership, it's part of our partnership structure looking locally at the needs of the city. We also then have joint commissioning arrangements, which are joint between ourselves, North Yorkshire Council, and the Office of Police, Crime Commissioner. One of the first things we did when we started on this work, when some of the extra funding came through, was to commission an organisation called Safe Lives to do a needs assessment that looks a little bit at what some of the needs are. That's briefly mentioned in the report, but in the strategy that we're presenting here today, the summary of the needs assessment can be found on page 12, and it shows the figure I quoted earlier on, around 32,000 people affected. It talks about the number of people who have sought refuge in a formal shelter. It talks a little bit about the gender balance. This is an issue which does affect females more than it affects males, but that's not to say that it doesn't affect males. And we know that there are some parts of the population who are more likely to be affected. And it also talks a little bit about the children living in households where domestic abuse is present, and to note that one of the changes that the Act makes is to consider that those who witness domestic abuse and who are under 18 are no longer just witnesses, they are victims themselves of domestic abuse. So the Safe Lives needs assessment was the first piece of the puzzle, and then the second was jointly writing a strategy. And what the strategy does, it puts us all on the same page across North Yorkshire and York. It gives us a set of key priorities, which I'll come on to, but crucially, it helps us direct our funding. Both councils and the Office for Police Crime Commissioner were already spending money and using resource on domestic abuse before the Act came into force. Some of the new resource that has come from the Department of Health, Housing, Levelling Up and Communities, adds to the pot that we all have to tackle this issue and sort of grows it by approximately another 100%. The strategy, therefore, that we put together is the thing that we are using to direct our resources. So whether we are doing new work in housing and looking at something like the Domestic Abuse Housing Accreditation Scheme, whether we are doing work to commission support for child victims, support around the perpetrator and perpetrator services, whether we're commissioning support to our refugees, we're using the strategy as a way of prioritising. And the four key planks of the strategy are around prevention and early intervention. Very much that work around awareness raising, making sure that a whole multitude of professionals, from GPs to health visitors to housing officers to people on the customer centre at the council, are aware of domestic abuse, some of the signs, and what you do if you are concerned about someone, and helping people who are experiencing domestic abuse to feel confident to access the support. So there's a lot around partnership, engagement, increasing the amount of disclosure and empowering individuals to become active bystanders within that. The second priority is about authentic and inclusive support for all. So this is making sure that we've got specialist support services in place that are high quality. We're making sure the voice of victims and of survivors of domestic abuse are really listened to and incorporated in the way that those services work. The work around our Domestic Abuse Housing Alliance accreditation, we are looking after 2 years of this strategy for York, and a long process of, I guess you might think of the quality improvement of submitting an application to get DAHA accreditation, which would be a real kite mark, I guess, a gold standard on our housing services around domestic abuse, because so often people's housing and accommodation is the key bit which we need to get right. The third priority is about driving change together. That's about making sure we have the right local partnership board arrangements. There's a lot around data. I would say, coming from health background myself, and public health is often swimming in lots of data. This is potentially an area where, in some ways, we really need to work on the collection of data. We're probably not collecting data in the right way or sharing it in the right way, and probably have made significant steps towards that, but we need to work on that together. Another aspect is around the multi-agency arrangements for responding to incidences of domestic abuse and making decisions about what support an individual or groups of individuals should be channeled into, and how agencies need to take steps to respond to safeguard. The ultimate and tragic thing we're trying to avoid here, but it is right to mention it, is domestic homicide review process. We never want to get there, but there is a statutory process, the domestic homicide review, that has to take place when such events happen. To make sure we don't get to that point, we have multi-agency arrangements with glorious acronyms, MARAC and MATAC. MATAC is a bit more operational around tasking. The MARAC, the multi-agency risk assessment conferences, are much more strategic and are very much about bringing partners around a particular set of cases, considering them on often a whole morning or whole day sessions to say, what are we learning from these cases? What can we do better? And where might we need to take immediate action? And at this point, I would say that unlike in some safeguarding areas, the statutory duties on organisations to attend MARAC are slightly less strong. We appreciate that many of the agencies involved, our health colleagues, our police and criminal justice colleagues, are often very stretched at the moment. But I think there is something about using this strategy as a tool and a plea to agencies to participate in MARAC, to be involved, to be able to set aside the time to attend, because when we get really good partnership engagement, we do find MARAC to be a really effective vehicle in taking action and making sure that the system is improving. The final priority within the strategy before I finish is accountability. There is something about our perpetrator services and that very high level of challenge through them. We know that part of prevention is working with those who have perpetrated. That is in no way to circumvent any criminal justice aspects of the work that is happening there, but it is to say that if you want to stop something reoccurring, that is a part of the strategy you need. Giving perpetrators an opportunity to change their behaviour, giving them the evidence-based interventions that we know do make it more likely that behaviour will change, but making sure we have the legal orders and notices, the DVP N&Os, the domestic violence prevention notices, the criminal justice levers that we have, that they're well understood, that partners understand them, and as and where we do need to safeguard someone, we use all the legal powers that we have at our disposal, particularly that the police have at their disposal, in order to safeguard vulnerable adults and children. So I commend the strategy to you, Councillor Coles, and to the council. The request of me as Director of Public Health is that as a council, we adopt this strategy as one of part of our sort of strategy portfolios. We are aware that this is being written sort of on a wider regional basis, but it's really important that the council looks at this strategy and makes sure it signs up to it, because ultimately our regional partners can't do anything themselves. They work through the likes of City of York Council. So we're asking for the strategy to be approved today.
Brilliant. Great, thank you, Peter. And I am obviously, yes, very, very happy to adopt the strategy and really welcome all the work that has gone in from officers and partners in pulling it together. It is a real, it's kind of it's something that when we get it wrong has such tragic outcomes that therefore doing everything we possibly can to get it right as often as possible feels really important. It's certainly a priority for me personally. It was actually that Safe Lives report that you mentioned was one of the first things I attended as an exec member for the council to kind of properly understand the needs and the challenges in the system. And I remember kind of just the number of stakeholders, the voice of the victims who spoke at that event. Those are the things that kind of strike me as being really important. I was particularly pleased, and I'm particularly pleased to hear that the voice of victims is at the heart of our strategic approach. And also because I think that really plays into the importance of accountability, which is another one of the priorities of the strategy. You know, if we are not listening properly to victims, then we aren't going to properly challenge our agencies, of which there are many that are all involved in the delivery of this strategy. I did just want to thank, obviously this is a strategy that sits between York and North Yorkshire. We're very, very happy to take our active part in it. I should also just mention the North Yorkshire Community Safety Partnership, the Police, Fire and Crime Commissioner for North Yorkshire, who I know is also involved in this, as well as the health partners from the ICB. the Tees Weir Valley NHS Foundation Trust, the voluntary sector colleagues, particularly IDAS, who deliver our refuges here in York, and other voluntary sector partners, including statutory services like the probation service. All of those are so important in making sure that this approach is a true partnership approach, and that we will play our part in driving that forward. There were a couple of things in it that struck me when I was going through the paper. One was just around the demand and scale of the problem, particularly the numbers in York, which have remained broadly constant, albeit with a slight dip in 21-22, but we have over 2,000 related domestic abuse related crimes in York last year. That's 2,000 victims, potentially many more victims, because each of those crimes could have a victim, and there may be children who, as you very clearly set out in your remarks, could also be victims if they've observed domestic abuse taking place. The other thing that struck me in the report were some of the kind of the patterns in behaviours that I think is really important in terms of our awareness and ensuring that we have proper voices for those that are affected. But the rise in older victims between 59 and 79, just being aware of the fact that there is an increase in the number of older victims, I think is really important for services to be able to properly understand who they might be speaking to and what people might be saying to them. I also wanted to touch on where there might actually be some gaps in our understanding, which I think the report touches on really clearly around page, I think it's around page 43, 44 of the Qualities Impact Assessment, particularly around disability and the disproportionately higher rates of domestic abuse for people with disabilities, who are likely to experience domestic abuse if they experience it for longer and more severely and more frequently, which I think there's obviously been, actually it's a bit out of date now, but that Public Health England report, I'd be interested to know whether any of those patterns have changed, but I think that's really important that we're aware of those kind of gaps, and particularly around pregnancy and maternity and those kind of risk points for people when we know women in particular are more vulnerable to domestic abuse. I also, you mentioned the domestic homicide review process, and obviously no one ever wants to get to that point where that stage is necessary, but I would also pay tribute to those organisations that do focus on the tragic end of domestic abuse, when people have been killed, and it is at that point that those people no longer have their own voice, but actually there are organisations I know, such as the Femicide Census, who try to give a voice to those victims even after they've been killed. And I think that is a really important part of ensuring that the voice of victims carries on at all stages in our strategy, and we don't ignore things even when ultimately statutory services will have not been able to save someone. It doesn't mean that actually there aren't lessons that can be learned and ways in which we can improve. I also particularly liked the area of the report that talks about this being everybody's business, and I think that is really important. This is not something that is in just the council or the police's responsibility. This is everyone's responsibility. And as you, Peter, very clearly set out in your remarks, housing services in particular play a really important role here. We've got a domestic abuse housing worker for the City of York Council, which I understand some of our local authority duty grant pays for, but we also know that budgets across the piece are under a lot of pressure, and there would be even more that we could do if there was more funding available. But having said that, I think it's really important that anyone who feels threatened or is able to knows that there are services there to help them. So even though our budgets are under pressure, this is a priority for us. It aligns with our council plan and some of our EACH principles, particularly around equalities and health. We are taking a public health approach to this so that we are cross-cutting the work that we are doing across the whole system to work with our partners across the piece. And then just finally, there is some hopefully increasing opportunities as this strategy moves forward between now and 2028 with the combined authority and the York and North Yorkshire Mayor coming into place in May. There may be some future opportunities for increased joint commissioning, increasing support for those victims and those services so that we can do even better and ensure that those gaps in the system or that those we keep an eye on the data and that we provide as much support as we possibly can for our victims and survivors of domestic abuse. So thank you. I'm absolutely delighted to welcome and adopt the report. Peter, did you want to say anything in response to what I've just said? And then we can move on.
A couple of really quick points, Councillor Coles. You mentioned the rates of incidents that we're collecting. And yes, you're absolutely right. I think generally we would say we have more than 2,000 incidents or crimes rather, North Yorkshire Police recording every year. And I think it is interesting to see that in 2021, the first year of the pandemic, that dipped slightly. And I think people just weren't reporting as much, but we knew at that point, and publicly, nationally, people were saying we would have a lot of hidden need, people spending more time at home. The clues in the name, domestic abuse. And absolutely what we then saw in 2021-22 was essentially, another 10% sort of increase. That did go back down in 22-23, and I'm interested to see, are we sort of essentially on a rising trend or not? You're right to highlight gaps in data. The disability section of the EQIA, I think, shows that whilst we can look at really good national reports and what the academics tell us about higher rates, and we need to respond to that, when it comes to saying, well, what does that mean locally? There are gaps there. So I think there is something around data which is important. And then lastly, just you use the phrase everyone's business in a public health approach. And I very much do see this sitting under public health, giving us the opportunity to take as preventative an approach as we possibly can here. It's often the stuff that's hardest to do because you can't prove you've prevented something. And, you go out and you spend resource on training lots of GPs, running events, producing posters and flyers and all of that sort of preventative stuff. It's very difficult to link that through into what you prevented, but it does have a link. It's clear that that this, in some ways, domestic abuse is an issue that builds up across sometimes a number of years within a situation. It often doesn't just suddenly emerge, and thus it gives you that time at some point within that journey to intervene, to act, and to hopefully break the cycle. So I think the theory very much supports, the public health theory very much supports doing as much of that preventative work as possible. And that really is the really simple stuff, but it's just doing it at scale and at volume. We have how many thousand people working for the NHS in York, probably into the tens of thousands. How does each of them have just a really basic awareness, literally probably half an hour's worth of thinking and training and support on this issue in their career, which would set them in good stead for the rest of the time that they do their clinical work. So I think work like that, I'm really keen on making sure we do across the whole of public health and definitely within this area. Thank you.
Great, thank you. Just formally, I'm very happy to approve and adopt the North Yorkshire and City of York Domestic Abuse Strategy 2024 to 2028. Really, really pleased that we're taking this approach and look forward to continuing to work with partners across both the city and York and North Yorkshire to ensure that we do our very best with this. On that, I can move on to any urgent business, of which there isn't any. And so I'm very happy to close the session after we've approved and adopted that strategy. So thank you all for attending.